Hey there, Dr. Norris Goldberg. Welcome back to the Spinal Hygiene Exercises 2.0, and I am the owner and clinical director here at Koru Chiropractic. So if you're seeing these videos, there's a good chance you're getting quality corrective chiropractic care, and there's a really good chance that you have forward head posture. You've probably heard me say this already, but this is the 21st century problem. We all deal with it. In fact, you're probably watching me on a phone or a computer right now, which really means that you're probably in forward head posture as we speak, right? So ideally, I'm gonna take a minute to explain, again, just what this really is, and then we're gonna talk about some stretches you can do to help combat forward head posture, okay? So forward head posture is simply where that 10 to 12 pound weight of your head, the ear hole doesn't sit right over the front of your shoulders, your hips, your knees, and your ankles, okay? And so a lot of people come in with this forward head posture, which eventually rounds your back. Some people, especially women, will develop a Dowager hump, right? So as we go forward, we're not gonna just look down at the ground, we're gonna kind of bring our eyes back up to the horizon, and that's what creates that humping in the upper back. We'll get really tight, like in our pec and our chest muscles and our anterior neck muscles right here. So I'm going to show you again a bunch of stretches to deal with that, and then on the next video is going to be a bunch of exercises to help with that, because we really have to balance it out both ways. I want to give you one more visual so you really understand how important of a problem this is. Even if you're not experiencing pain, stiffness, or discomfort right here, if you are dealing with any spine-related health problem, and really if you just care about your health and your longevity in general, we should keep talking about posture. So got this little hammer here, and as your head sits, and it should sit head over, let's call this your pelvis, right? And so here's your spine, it's like a stack of blocks, and that's great. But as the head shifts either to the side, that's gonna put stress. As the head moves over here, I'm feeling it in my hand and my forearm. Or if we're here and we move forward, again, where do I feel that stress? I'm starting to feel it through my wrist, right? So I'm not feeling it in my head, even though this is really the problem. Once we bring that head back to center, all of a sudden the pain is gone, right? And so this is a tried and true method, and really as we focus on your spine with corrective care adjustments, the goal is always to try to get the head over the hips. So if you're like most people, you probably sit at a desk, or at least for part of the day, if not all of the day, and then you probably drive, like most people, on average about 45 minutes in their car each way to work, right? And then we also play taxi mom and dad. We sit at home and enjoy our Netflix. We spend a lot of time sitting. And when we're seated, we don't really activate our core. Our posture muscles aren't really working for us. And so really we're just gonna shift into whatever is the most efficient, comfortable position possible, all right? So classically, the same muscles get tight. No matter what you're doing to get to this point, it's a similar pattern for everybody. So chest stretches, we want to stretch it just like this. All right, guys, so here's that chest stretch. The one I like is just like a simple door frame stretch. A lot of us have done this. The first one, though, there's two variations of this. First one is with your arm at 90 degrees, right? And then usually I'll step forward with my opposite leg, just get a little bit of tension through that chest. I'm really trying to like push my chest forward. I'm not letting it just turn against the door. Some people maybe need to step forward with the same side of the leg just to like help reinforce that. I don't think it really matters. I think what matters is, are you feeling it in your chest here? So for this one, you should really feel it come all the way across. Pec major covers that space right there. Hold it for about 60 to 90 seconds. All right, number two though is pec minor. And honestly, if there was one that you had to do, one that I find affects patients the most is this one. It's kind of like the sneaky hidden stretch no one really knows about. If you put your elbow at about 45 degrees right here, right? So I'm at about a 45-degree angle, and then I step into the wall. Oh yeah, I'll get a way different stretch. So I'm right up here, it's like in my shoulder, ball joint, in my, right where pec minor goes, of course. But it feels like where a lot of people tell me they're getting like tightness and, you know, kind of pinching pain, shoulder pain. Sometimes their neck pain even kind of travels through that area. And it's certainly a very chronically tight muscle that can affect your posture. So make sure you try those two out. So we're just opening up the chest there. Next, we're gonna focus on these muscles right here. A lot of people don't even really know. I mean, sometimes people have pain. They go, oh, I got pain is like right under my collarbone there. A lot of people are surprised though how tight these muscles really are. And you know, we can get into the specifics of each individual muscles. There's really dozens on both sides. But for me, I like to focus on the feel. I think that's the best thing. I'm not expecting you to be an expert in anatomy. I don't want you to really try to memorize which muscle is tight, which one's loose. I just want you to stretch what feels tight, right? So if you just did the chest stretch and one felt fine, the other one felt tight, just focus on the tight one, right? That's the one that really needs the attention right now. So in your neck, let's just start by doing something simple. Let's just take the side or our hand and just put it behind our back. When I start doing my stretches, I'm gonna be focusing on this side, but what that does is as I'm stretching, it can keep my shoulders locked in place. So I could even do it with my second hand. I could hold my hands behind my back while I'm doing these stretches, or I could even sit on my hands, kind of put them right behind my pockets. And that's just gonna keep my shoulder blades down so that when I move my neck over, I'm not just like lifting the muscle up or allowing my body to compensate and really not getting the stretch as deep as I'd like, all right? So again, I'm just for this one, simply gonna interlace my hands behind my back. That just keeps my shoulder blades down. And then we're just gonna do the stretch to the side, right? So just gently, ear to the shoulder. You're gonna feel a little stretch right along the side of the neck, kind of pulling down from your ear, maybe even across the shoulder, like almost along that seam of your shirt, right to the tip of the shoulder there, okay? If you're getting pain with any of these, stop immediately. Please do not hurt yourself stretching. However, if there's slight discomfort, it may be something that's tolerable to work through. If you're having a lot of pain, let me know about it and we can try to workshop which stretch is specifically hurting and why that might be the case and what we can do about it. So first thing to the side, a lot of stretches, you know, if you just only got a couple seconds, go for it. It's still better than nothing. But really, if we can hold it for about 60 to 90 seconds while breathing, right? So hopefully you just watched my breathwork video and you understand the importance of breathing, especially with these tight muscles in your neck. And so sometimes you just gotta stop talking and breathe a little bit. All right, so that's the side one. The next one I want to do is to the side and then back. Once I go back, I start feeling it actually from my ear all the way to the front of my sternum right here in front where my clavicle and sternum meet. So I'm actually dumping my head back and go further and further. And the further I go back, the deeper that stretch gets. Next, we're gonna do the opposite of that. So this time I'm gonna go back, then I'm gonna go to the side and point my chin almost up towards the other ceiling. So as I turn and dump over, and again, the difference was the first one I went to the side and then back. This one I'm going back and then to the side, and you're gonna feel it in a slightly different place, okay? So as you go back and to the side and twist, I'm getting it like more down through the scalene muscles right through here, okay? All right, so let's kind of like add that up. Let's just like move our neck through its full range of motion. If I were to go around, where do I feel the resistance, right? So we're gonna go 180, not 360. I'm gonna go back and forth. For me, I always feel it right about there. So this one, my head went back and I'm pointing my chin up to the opposite side of stretching my shoulder or my neck. Whereas some people will feel it to that side, right? So be playful with it. Try to find where those tense spots are and then move that neck around, get it into a different position, feel the stretch, breathe through it. Give me about 30 to 60 seconds on those forward to head posture stretches. All right, guys, I hope you found these stretches beneficial. Let me know if you're having any challenges with them. And like always, try to do them on a consistent basis. That's really where everything in health adds up to a substantial level. So give these a go, try them for at least a week. If you're still finding a lot of tension and resistance, continue trying them, and let's talk about it on your next visit. I'm Dr. Norris. Hope you liked today's video. If you haven't already, make sure you subscribe because I'm gonna send out more later.